There you
Oh,
go.
perfect. All right, great. Maybe Casey did it. All right, so that just goes to show you need a team of helpers behind you. So let's give a shout out to Rebecca, Casey, Kristen, Anita, Dahlia, everybody that's helping behind the scenes in order to make sure that we're a success. We thank them. And you'll see dropped in the chat if you need closed caption or some additional support there. That information is there. All right, so we'll go ahead and get started. Cindy is going to get us started with the information here. If you can go ahead and go to the next slide, that'd be greatly appreciated, Rebecca. And the next slide after that. Thank you.
Good evening again. So one of the first things that we thought we'd do before we get started in talking about all the things we're going to do to unwind is to talk a little bit about how we got where we are. Back in 2020, when the COVID-19 public health emergency was declared, the federal government, through the Families First Coronavirus Relief Act, provided states a 6.2% increase in our regular Medicaid matching rate. But that increase in the matching rate was tied to certain conditions that states had to meet in order to receive the enhanced funding. One of those conditions was a continuous coverage requirement, which mandated that except for a few specific exemptions, anyone who was enrolled as of the date in March of 2020, when this began, through to the current time, needed to stay enrolled in their Medicaid coverage. The exceptions for closure had to do with people moving out of state, people who passed away, and people who requested that their coverage be closed. Otherwise, individuals had to stay enrolled. And one of the things that dealt with the continuous coverage requirement was that we didn't do a whole lot of Medicaid renewals during the past 3 years. So we have begun to work to transition our Medicaid members back to normal operations, otherwise known as resuming renewals, and that will start in March of 2023. We are and have been collaborating with our stakeholders across the Commonwealth. That includes our sister agencies, our health plans, advocates, application assisters, and our providers to try and ensure a smooth transition for our members and our partners. Next slide, please. Next slide. Okay, so we know that because we haven't done a whole lot of renewals in the past 3 years, that we're going to be faced with a significant backlog of cases that need to be redetermined at the end of this continuous coverage requirement. And that continuous coverage requirement ends at the end of March. So we have worked with the State Department of Social Services to make a lot of strides, systematic strides, to prepare for the end of the federal continuous coverage requirement by making a lot of system updates. And we've been working on system updates for the last 2 years in an effort to get ready for this moment in our time to improve the efficiency of the renewal or redetermination process. Hopefully, and what our expectation is that the system enhancements that we have made will reduce the number of individuals that could be inappropriately terminated following the end of the continuous coverage requirement. We have also developed a detailed plan to stage redeterminations. Not everyone can be redetermined at the same time. We've had to space these out over a 12-month period. So it will allow timely evaluations, and it will help us identify actions that will be required for each of our coverage groups. We are collaborating with our managed care organizations and to work with them to provide education and information to our members post end of the continuous coverage requirement. We want to make sure, and they are helping us with ensuring up-to-date contact information, such as addresses and phone numbers, and to remind members to complete their renewals. We are also addressing the return mail issue because, as you can imagine, when you have over 2 million people enrolled in Medicaid, that there are going to be a number of individuals for whom we don't have current addresses in a 3-year period of time since the last renewal. There are many individuals who may have moved and did not report their address changes. So we are working and have been working for a number of months to try and get as many up-to-date addresses for our members as possible to ensure that if a renewal packet does need to be mailed out or a notice does need to be mailed out to an individual, that information will get where it needs to go. We have communication plans. We have been coordinating language approval and scheduled delivery of our mailings, our digital and telephonic outreach, and Natalie will be talking about that in just a few minutes. And we also have identified the federal flexibilities that the Commonwealth put in place during the continuous coverage and the public health emergency, and the ones that we will maintain, and any new strategies that we may want to leverage in order to help with the unwinding process. Next slide, please. So our federal authority, the Centers for Medicare and Medicaid Services, has provided a lot of guidance. They continue to provide guidance to the states. And the guidance reiterates our obligations with respect to conducting full redeterminations of eligibility. We have to first attempt to redetermine eligibility based on available information without requiring the individual to provide any information. We call that an ex parte or an automated renewal. And if we can determine eligibility, or that ongoing eligibility exists, then the individual their coverage will be renewed. They'll get a letter in the mail. It says you're renewed for another year. And the individual or the member will not be required to provide any information to the local Department of Social Services. If the available information that we have is not sufficient to determine continued eligibility, then we must send a paper renewal form. It's pre-populated with all of the information that we currently have in the eligibility determination system, and we would request additional information from the individual so that a determination of ongoing eligibility can be completed. Before we can close a case, we have to evaluate for other eligibility categories, and we also have to share information with currently the federal marketplace for an eligibility determination when coverage can no longer be maintained in the Medicaid system. And also, before we can close a case, we have to give a member an adverse action notice, and they have to have at least 10 days prior to the end of their coverage, so that if they wish to appeal the determination of eligibility, they have ample time to do so. Next slide, please. This is a timeline of our redetermination processing, and it starts in March of 2023. So this month, after the middle of the month, we will run our automated renewal process. For all those individuals for whom we can complete a renewal, we will complete a renewal and renew them for another year. For those individuals who cannot be renewed using the automated process, paper renewal packets will go out to the individuals. We start our redeterminations of eligibility 2 months in advance. So the paper renewal packets that would be going out in March are for May renewals. The individual will have 30 days to look at the paper renewal packet and get it back to the worker at the local Department of Social Services. The first month that we can begin closing cases of taking adverse action on cases would be for May 1st. The 12-month period for us to get all of our redeterminations underway starts in March, ends in March of 2024, and April of 2024 would be the 2 extra months. So between March of 2023 and February of 2024, we must initiate all redeterminations of eligibility for anyone who's currently covered in Medicaid and our Title 21 programs. Then the federal government gives us 2 additional months to wind up the processing of those redeterminations That will be in March and April of 2024. And then beginning in May of 2024, we will be back on our regular work schedule of redetermining eligibility for everyone on an annual basis. Next slide, please. And this slide just kind of lets you know all the things that we've been working on since mid-2020. We have been trying to think of and put together plans for ensuring that we have a smooth transition once the continuous coverage requirement is over. We've made, as I said earlier, system updates. We've developed cleanup and pre-unwinding processes. We've done a lot of outreach and stakeholder engagement. We've done member outreach and engagement. We've developed training. We have policy flexibilities in place, and none of them have been made permanent. We have submitted and had approved 7 unwinding waivers, and then we have a number of temporary flexibilities. Some of them remain at this point in time. So I think that's my last slide, and I'll turn it over to Katie O'Connell-Raymond.
Hold up, Katie. Let me just make sure, because I forgot to give this instruction at the beginning. If you have questions, please drop them in the Q&A section. We take them all. It does not matter what they look like. We encourage you to ask as many questions as possible because we have so many subject matter experts here. Thank you so much, Katie. I apologize.
No worries. Good evening again. I'm going to go over some of what we at Department of Social Services have been working on in conjunction with the stakeholders and other agencies. Definitely, we've been upping our communication because we are, as everyone has stated, we're returning to normal operations on 4/1/23. So we have internal and partner communications where we're sending out messages with DMAS that we developed and distributed to local agencies that are going to prepare them for what we're about to undergo. We are having joint monthly unwinding statewide virtual meetings, and we are going over anything and everything that you can imagine regarding the unwinding, everything. And part of that, we've been lucky to develop different resources, FAQs, scripts for local agencies, and unwinding toolkits. There's some unwinding toolkits that are available on the Cover VA website that are very useful. I think that Natalie probably will talk about later. And the primary thing that we've been doing is trying to give the local agencies the guidance and advice that they need. They're getting ready to do something they haven't done in 3 years. You know, it's pretty amazing when you think of it. 3 years, no reviews, people have stayed enrolled, which is good, you know, that they had continuous coverage, but it creates a problem when people haven't done renewals in some time on the inside and the outside because the public's not aware maybe that they would have to do a renewal. And so we're giving them that different guidance that would be useful for that. There is an unwinding portal on our intranet. And on that site, we have different tools and things that the agencies can use, different presentations, recordings. You know, just as this meeting is being recorded, we've recorded all our other calls, and they can be used as a reference tool. Next slide, please. So for the public side, we're trying to make sure that everyone is aware of what's getting ready to happen. So there is social media messaging. You know, I've mentioned before that I've actually seen the messages on Facebook that we're getting ready to return to normal operations. On Common Help, if you're not familiar with that, that is a website where individuals can apply for almost every program.
Ready.
They can apply for almost every program on Common Help, except for Auxiliary Grant. And there's a message there on Common Help that tells them about the unwinding. That's been posted since November 22. On the VDS public site, which gives you the website down below, it's very easy to remember, dss.virginia.gov. There's messaging in place for the public regarding the unwinding and different resources they can utilize. And DMAS and VDSS have worked together to do joint press releases that will soon be ready once they're approved. And an interesting resource that I've reviewed that's presented here, that VDSS is joining efforts with the community to help bridge gaps in healthcare for our citizens. So for those people that are not eligible once a renewal has been completed, we're going to try to refer them to different resources. They do get referred usually to the federal marketplace, but they also can go to freeclinicscare.org. It's a wealth of resources. Anything that you can imagine, there's a resource there. And so I found that very useful just for my own, perspective to know what to tell people. Next slide, please. And this is a tool that is getting ready to be distributed. I'm focused right now on what's in orange, medical assistance, but we have to remember that there are other programs that are being impacted by the unwinding as well. To me, medical assistance is the most important program, obviously, but SNAP is being impacted as well. If you go down to that very light blue line at the bottom, the dss.virginia.gov/benefit changes, there are some tools there for the public that tell them about what's getting ready to occur with the unwinding or the return to normal operations, and refers them to different resources. Next slide, please. And just from our end, to let you know what we all have been working on to get ready for this, we've been providing training for local agencies to sort of amp that up. And a lot of that may be new program training for workers that don't have experience in Medicaid, or for seasoned workers that need it to be refreshed. We've been having roundtables and quarterly meetings with local staff to address their concerns about the public health emergency and the unwinding and the procedures that are getting ready to happen. We also have a lot of internal pages for them that are available on our intranet with procedural guidance and different resources, scripts that they can use when customers contact them about their case being closed and what steps they can take. And then we've offered different specialized and targeted training opportunities. Something new that they did for both the new and experienced workers was offer getting back to renewals. And it walks them through all the different steps of what they need to do to complete the renewal. We have to remember that we have staff that have, since they've been with their agency, they've never done a Medicaid renewal. And so what can they expect to do? We've created a training that they've been doing, but then in conjunction with that, we've been having system matter expert led webinars where those staff can then come and ask a panel of consultants, regional consultants, as well as home office consultants and staff from DMAS about the renewals, what to experience, what to expect with appeals, because that's going to be a part of what occurs as well. And we've also developed some checklist and processing guidance for local agencies to assist them in their upcoming tasks. And I believe this is my last slide, so I will pass this back to Natalie.
Thank you so much, Katie. And so you hearing from our agencies, what has been done? What are we doing to make sure that this transition happens smoothly for our members, most importantly, through our stakeholders and any other part of our Virginia Medicaid ecosystem of work and support. So for us, when we think about our outreach, communications, and engagement plan, it's a 3-pronged system, right? So you have phase 1 through phase 3. We've been in phase 1 for a while here, and I will be remiss if I did not give a shout out to, I think I saw Christina Knuckles in the mix here. And Christina used to be a partner in crime. She used to help us with our communications plan. So she helped us develop this along with some other things. I just wanted to say hello to her. But we have in our first phase 1, contact information, updating that contact information in order to make sure that people first and foremost can be contacted. You're going to hear from all of our subject matter experts today. One of the main takeaways is we can't do phase 2 and 3 if you have not done you can't do phases 2 and 3 if you have not done phase 1. And so we want to make sure that we have all of those things happening. As you go through phase 2 and 3, let's go to the next slide, because that gives us that kind of engagement. It lets us know what those things are. So when we talk about those stakeholder groups, first one is everybody. Everybody can contribute to making sure everybody has updated contact information. The second phase, we want to make sure that all stakeholders are engaged, because that's actually about renewing packets. That's about making sure you complete the information that is there. And if we don't make sure that our members do this, they are they're at risk of losing that coverage. And that is not something that we want to take place. Phase 3 is really about what has happened if, they updated their contact information or they didn't, they missed the mail for whatever reason, they didn't complete the paperwork as necessary, and they lost coverage for administrative reasons, for whatever reason that may be. We want to make sure that primarily like our health plans and then our marketplace navigators can help them, but we also want to make sure that you as stakeholders know what is taking place once they get to that point, if they have lost coverage for whatever reason, what that process may look like. Next slide, please, Rebecca. So as we're going through all of those things, I want us to really reflect, what are the things that we have done and done well? So we have a digital ad campaign, a social media campaign, a Cover Virginia website updates, and then we have updates that have taken place on the VDSS side, as well as our DMAS agency main website, but they redirect to Cover Virginia where necessary in order for you all to stay engaged and stay informed about what's taking place. Develop toolkits for our health plans, our stakeholders in general. We've created toolkits in order to make sure providers and our stakeholders at large understand what's taking place in those phase 1 and then that phase 2 and 3 combination toolkit. We've mailed member flyers and posters to our local Department of Social Services offices, as well as our Community Service Board offices. And we plan to do that again for our phase 2 and 3 documents. We've translated our documents into the 6 additional languages, so 7 in total. For our partners, they have memos, they have health plans that are well informed and giving great guidance about what they should be doing and how they can do that in collaboration with our stakeholders. They've held virtual meetings with we've held virtual meetings with a lot of our community partners and our navigators. We've also made sure that we created forums like this one, our town halls. This is our 4th one. And we're trying to make sure that you as a stakeholder, you as a community leader, understand and know what's taking place, making sure that you can navigate this process, because it's not just complicated for our members. Sometimes it could also be complicated for our stakeholders. And we want to make sure that that is not always the case. Next slide, please. So these are what our stakeholder toolkits look like. When you're talking about all those wonderful things that Cindy references, and then sometimes when Katie, we want to make sure that first and foremost, you know how to navigate to the spaces that will give you some additional information as you're trying to make sure they understand the complexity of it all. In our phase 2, 1, 2, and 3 toolkits, you'll see here, you can find them on our Cover Virginia website. We went through a refresh this weekend, and so we're making sure we clean up some things there, but that is where you will be able to find it. In the top right-hand corner, you'll see a return to normal enrollment kind of tab, and you can click on that, and then you'll see as that pulls up over to the right hand side, 4 kind of buckets, the very last one being toolkits and materials, and you want to click on that and click on either phase 1 or phase 2 materials. As I said before, we went through a transition over the weekend. We're aware of some of the de-linked stuff and we're relinking them, so those should all be fixed in the next day or so. So don't get discouraged if that is happening. We want to make sure you have the information that you need, so that should be updated and returned back to its rightful linkages soon. Next slide, please. So we also have some additional resources that we added to the phase 2 and 3 toolkit, because we understand not everybody's familiar and not everybody remembers what those phases are. And we also want to make sure that as they're going through, they understand what their responsibility is, because Virginia Medicaid, which is a system, right? It includes VDSS, it includes DMAS, it includes our MCOs, it includes our stakeholders like you, it includes our members. Everybody is under that umbrella, and we want to make sure that we understand what is the responsibility of those who are in that system, and then what are the responsibilities of our members who are navigating through that system. This is a more simplified version of what that could look like. It doesn't, provide all the nuances of a process, but it definitely gives some foundational understanding of what it should look like. Also, it makes sure that as our stakeholders like yourself and our members are navigating this system, they know those points in time where we need something from you and where you may be waiting on something from us. So making sure all of that is in place. This document in particular will be available for ordering on our Cover Virginia website in the next few weeks. And so we'll make sure as an organization that we provide what you need, and then hopefully you as a stakeholder will make sure you use those tools when engaging with our members. Next slide, please. So these are some flyers and some posters that our team did a lovely job of helping to develop, and also make sure that some of those things that are kind of sprinkled throughout the toolkit is really synthesized in a place that you can hand a document to our members to say, hey, this is what this looks like. You want to make sure you're navigating this well. We want to make sure that you understand it really is important that you keep coverage. You know, our team members, they go through our community members go through so many different life events, important life events where they have a promotion, they get a different job, they make more money, and they're in a transitional state. And we want to celebrate that, but we also want to make sure that they understand what's most important to us is that they maintain coverage of some kind. And it does not have to be through Medicaid, it could be through another avenue. And if that is the case, that we are able to redirect them to that. But again, we can't do that if they don't have an updated contact information in our systems and we can't get in contact with them. So you're going to hear that over and over again from us, because we have to make sure that that contact information is up to date so that we can make sure we're in contact with them about what those next steps look like and how we can connect them to other resources if necessary. Next slide, please. So what do we have so far? So we have, this morning we finished our housing programs. Well, this afternoon, it was during lunchtime, town hall today. This evening, we're finishing up our advocates one. We have 2 more that are taking place, one on tomorrow, and then we have 2 that are taking place next week. And as we go along, please invite anyone that you think this will be beneficial for to any of these sessions that you think the subject matter is appropriate. The content is very similar from one to the next, but the questions, as you talk about the different stakeholder groups, they do vary. Some are similar and some have some variation. What we're doing is collecting all of these questions and all of these different points of resource need and placing them in a FAQ document that will also release at the end of our town hall sessions to make sure that you have some answers to some questions in a more tangible format. We're also asking that if you would like to attend all of them, you are welcome to do so, and we encourage you to do so because that's what really is important. Next slide. So what's the takeaway? What are we really asking you to do here? We want you to remember, all right, Medicaid renewals begin this month. That ex parte process that Cindy mentioned earlier is going to start, and people are going to start receiving some things in the mail, hopefully because they have updated their contact information. We can get in contact with them, and they will start to get these renewal packets. And when they start to get these renewal packets, how can you support Virginia Medicaid? I'm gonna drop down to the other one because we need you to help them actually navigate that process. It may be new for them. And if it is new for them, we want them to be successful in that process. And so we want you to be prepared to know what they need to do and how we need to connect to the certain components of how they can renew that packet. This is a 12-month process. Cindy mentioned it. It is staggered. Not everybody will renew it at once. It is over 2 million people. Let's pause to have a greater understanding of what that means for our agencies to have to go through this process for over 2 million people in just 12 months. We only get 12 months. We get an additional 2 months for cleanup, but that extra 2 months don't mean anything when you compare it to just the 12. So we want to make sure that in that time period, we're making sure that everybody is navigating successfully through it. That also means, though, that people might need to wait to hear from us before responding, right? We don't want you to jump into the pool of renewal and you got at least 9 months in order to get there. We want to make sure that you're responding when you need to. And the only way we can ensure that that is actually taking place is, again, say it with me, if you have updated your contact information. If you have updated your contact information, then you can it's a breeze for you. You can wait for us to contact you. But if you haven't done that, then, you may run the risk of missing some really important information that can lead to you unnecessarily losing your coverage. The next thing about supporting the Virginia Medicaid ecosystem is making sure that when our members receive this packet, they get the support that they need. On the next slide, we'll talk about all of the different ways in which you can address or move towards renewing that packet and what mechanisms you can use for that. The last thing is make sure you provide additional feedback to us. Any point of entry you have into our system, it's important for us to know that you're able to use the resources and tools that have been created. It's also important to know if there's any gaps in the resources that we've created, because if there are gaps and you're finding that, hey, there's a point of confusion or there's not clarity, reach out to us, let us know, because at the end of the day, what's most important is that you're successful in doing what we know you do best, and that is serving and making sure you provide the best possible customer service to our members. Next slide, please. So Cindy, do you want me to take this one or do you want to take it?
I can do it. I'm sorry, I had to turn my video off so I could sneeze. It's allergy
We'll bless
season.
you afterwards then.
So, how do you renew your Medicaid coverage? There are 3 different ways. We would encourage individuals to use the way that is most comfortable for them. If you are someone who receives a renewal packet in the mail, you can renew by calling Cover Virginia, and the phone number is there on your slide. You can renew online by going to Common Help, and the address for Common Help is there on your slide. Or you can complete your paperwork and take it to your local Department of Social Services. And if you go to the web address that's down under the in-person box, you can find your nearest local Department of Social Services by visiting that and looking for the locality address for the locality where you live. We also would encourage you, if you want to learn more about the Medicaid redetermination process, to visit the Cover Virginia website, because there is an absolute wealth of information there about redeterminations and how to get them done. There are a number of people who won't have to get this paper renewal packet in the mail, because they are individuals who can be renewed during using the automated process. And we have been using the automated process all along. So we've been doing ex parte renewals all along. And so a number of people have currently up-to-date renewals. They get their letters in the mail that says, you know, you're renewed. You don't have to renew again until 2024. You're good. You're good as long as you have current renewal, because you'll be picked up for the renewal process again when your renewal month comes along. But we have a number of people who are not able to be successfully renewed using the automated renewal process. And so they'll get a renewal packet in the mail, and then one of these 3 processes can be used to renew your Medicaid coverage moving forward. Next slide. Or is there one? Yeah.
There is. So we thank you. We thank you so much for taking the time to spend the time with us this evening to learn a little bit more about these processes. What are we doing? How are we working collaboratively? We know that we can't do this work alone, let alone, DMAS can't do it without BDSS and vice versa. We also can't do it without our MCOs. We can't do it without you as our stakeholders. And we definitely can't do it without making sure that our members are cooperative in the process and of itself. So we want to thank you so much for helping. So we're going to switch over into our question and answer portion of the evening, and there's plenty of questions. And so I will start with a very basic one. How would someone know, and this is one, well, first, before I start the process, let me make sure everybody is here and they can answer and they know who's speaking. So we've already had introductions from Katie and Cindy. Ann is here. Ann, do you want to give introduce yourself?
Hey all, Ann Bevan. I am the director for the Division of High Needs Supports, which specifically does cover a lot of people you may be advocating for, people with developmental disabilities and those waivers. We also have brain injury and housing and employment.
All right, and I think we are the 4-woman team this evening. I think that's everybody. I don't see Tia. I don't see Jason. I don't see Aaron. Okay, so I think it's just
Bill Zeeser. I'm standing in for Tia this evening.
Oh, thanks, Bill. Can you introduce yourself?
Sure. I'm Bill Zeeser. I'm the Senior Program Operations Manager. I work underneath Tia, and basically we oversee all the fee-for-service program. So I'll be answering a lot of the provider questions and different things like that. But thank you.
Thank you, Bill. All right, so let's start with
Michael Puglisi is here if we have any appeals-related questions.
Mike. Oh, thank Michael. And so you may get some. So Michael, go ahead and introduce yourself. What did you say?
I'm Michael Puglisi with the DMAS Appeals Division. I'm the Eligibility Cases Manager in the division.
Thanks, Michael. Anybody else from DMAS or VDSS that is here to help answer questions? I want to make sure everybody knows who's in the room.
Hi, yes, good afternoon. My name is Sevda Nixon, and I'm the PRSS lead analyst, and I report to Tia, and I'm standing in for her this afternoon or this evening as well. So any program operations or provider enrollment questions, I can help out.
And pronounce your first name for me one more time.
It's Sevda
Sevda. All right. Thank you, Sevda. All right. So I think we have a full panel of our SMEs. So we're going to go right into it. So this one I can tell you right now probably is for Cindy. But how will they find information on the current income qualifications and requirements for applying for Medicaid if they don't currently know where that is?
Actually, there's a lot of information on the Cover Virginia website. There's a tab about apply. And if you hit that apply tab, there are screening tools there, income limit charts are there. There's information about how to apply. So if you go to the Cover Virginia website, it should give you all of the information that you would need to be able to fill out an application and get it completed and have some information about the requirements.
Thank you, Cindy. I need to record you so you can be our commercial for that site. So the next question, and we have a couple of them that are along this theme. How is DMAS determining when a Medicaid case is up for renewal and when that particular period will end? Is it by alphabetical order? Is it by a certain methodology? Cindy, or who else could somebody speak to that particular component?
I can take a stab at this one, although I didn't have anything to do with it. The caseloads, the numbers of individuals that that need to be renewed were just broken out into a somewhat equal amount over the next 12 months. And when we look at the cases that need to be renewed, they're looking at cases that are currently due for renewal in a month, as well as a portion of the backlog redeterminations that need to be completed. So if you are someone who had a redetermination that potentially was due in September of 2020, that may not be your renewal date anymore because you're going to be evenly distributed out. The caseloads are going to be evenly distributed out so that the local departments of social services don't have all of their redeterminations stacked up in a couple of months in 2024. And so they have tried, the individuals who have worked on this, to evenly space them out over the next 12 months.
Perfecto. All right, so one of the questions that came through is, will this deck be available? Yes, all of the recordings from each one of the sessions are posted soon after the session. And then at the end of all of our sessions, we definitely will be posting the slide deck so everybody can see that. So that should be an easy one. So if somebody is automatically terminated due to ineligibility, how would that information be sent over to the marketplace or / state-based exchange? And then what will be the process for them maintaining coverage afterwards?
So there's an automatic referral that goes from the DSS eligibility determination system to the marketplace. It transmits the information that we have on file for the person. And then once it gets to the marketplace, there's a process at the marketplace for determining eligibility, and the individual will hear from the marketplace. They may need to make contact with the marketplace, but at the time that we refer an individual's case to the marketplace, they do get a notice that lets them know that their case has been transferred to, or referred to the marketplace for an evaluation of eligibility for the programs of subsidies, the cost sharing assistance that is offered on the marketplace.
Perfect. And can you remind people of the timeline for how long it takes, how long they get for redetermining a packet once it is actually up for renewal, how many days they get for notification, if that in fact will come to an end, and what happens if they have lost coverage, how long it takes for them to come back?
Okay, so we start the renewal process 60 days in advance. Renewals packets that we send out in March will be for May.
What? Can I have a couple more? No, just
renewals.
Please, 2 more bags. I mean, you can keep getting them.
Hey, folks, can you all mute, please? We're getting some nice conversation in the background.
Thanks, Ann. So you have, once you receive your paper renewal packet, you have 30 days to review it, make any necessary changes, and get it back to your local Department of Social Services for processing, and then they get 30 days to get it done. If you are determined to remain eligible for coverage, you will get a notice in the mail that tells you that your coverage has been renewed and your next renewal is due a year from whatever month that would be. If you are not eligible, you will get what we call an advance notice of action, proposed action, that will let you know that your coverage is going to end at the end of that month. So if you have a May renewal, then you're no longer eligible, then you would get a notice in the mail that would say that your coverage is going to end at the end of May. Depending upon why you are no longer going to be eligible for Medicaid, your coverage may be referred to the marketplace. If you're no longer eligible for Medicaid because you did not follow through with the renewal process, i.e. you didn't turn your renewal packet back in, or you were asked to provide some information so that we could determine your ongoing eligibility for Medicaid, then your coverage will be terminated. But because we could not make a determination of eligibility for Medicaid, or ineligibility, as the case may be, we would not be referring those cases to the marketplace. Instead, you would have 90 days to provide the information that is needed to have that redetermination of eligibility completed. And if you turn in the documentation that's needed and you remain eligible, then your coverage will go back and be reinstated to the first day of the month after you were closed.
I think you're on a roll, Cindy. So I have another one for you. I think so. If an individual wanted to check for their renewal date, is that possible now? And if they wanted to know if they would be qualified for the ex parte process, can they know that now? And if they don't have that information, who should they check with in order to figure out what that date is?
So let me start with the ex parte process first, the automated process, because to me that's the easiest one. Most of the individuals who successfully go through the automated renewal process are individuals for whom a resource test is not needed to determine eligibility. So we're talking about children, adults in the expansion coverage group, and our SSI recipients who meet our more restrictive resource requirements. And so we don't have to look at resources. So those individuals will go through the ex parte process. And if that's successful, they'll get the notice that says, they've been renewed. If not, they'll get a renewal packet in the mail. But there's no way to go to the Cover Virginia website to look up your case number to see whether or not, what month your redetermination is due. That is not information that we would post on the website. I'm struggling with trying to decide whether to say you could call Cover Virginia, but whether or not they would be able to give you renewal dates over the phone, I don't know. That's something that we would probably have to have a discussion with them about, because if all 2 million people started calling Cover Virginia for renewal dates, the phone lines there would be overwhelmed with callers. So individuals, I think the important thing that if you're helping someone, the important thing to tell them is to not worry about what their renewal date is, but to know that if they're able to be successfully renewed, they will get an approval notice in the mail that tells them that. If they are not able to be successfully renewed through the automated process, they will receive a paper renewal packet in the mail, and it will come at the time that their renewal is due, or in the 60-day period before their renewal is due.
All right, I'm going to give you a break and go over to Michael. We have a question that what happens if someone gets denied? How can they appeal that decision? And what does that process look like? And I would say in the most concise version that you can give, because I know that probably is a complicated question.
Right. The easiest way is to use our online portal. You can access it at dmas.virginia.gov. It's under the Appeals tab dropdown on the top line. You select Appeals Portal Login, and you can go ahead and file your appeal electronically using the portal. It's really quick and easy. Of course, we still accept all of the old methods of filing an appeal by mail, by fax, by email, even by walk-in. But obviously, the most efficient for everyone is the online portal. And we're going to be requiring those appeals, of course, within 30 days of receipt of the notice of action. So it's important to keep those timeframes in mind when you're evaluating your choice to appeal. I hope that was concise enough. If there's any follow-up, just let me know.
Will do. Thank you, Michael. Another question, and I don't know who would answer this one. Will any benefits for undocumented individuals, families, or students be changed during this redetermination process or afterwards?
We will not be changing any benefits. Undocumented individuals are eligible for emergency services, and that will remain throughout the unwinding period and beyond.
Thank you so much. I have a couple of questions that I know I can answer as the outreach and communication person. It is whether or not we will have available posters, flyers, and brochures for community organizations. Absolutely, there's a plethora of different information located on the Cover Virginia website. You can order some materials. Some materials are available for ordering, and some are just available for digital download. And you can print them you can print them yourselves internally for whatever events or opportunities that you need to have for your community members. So feel free, if you're finding that you don't have access to something or is not represented somewhere, please don't hesitate to reach out to us at the Cover Virginia at dmas.virginia.gov email address that you see at the bottom there, and we'll see what we can do. If we can do anything that may exist and you just had a hard time finding it. The other thing is, flyers, can you print and hand out flyers? Absolutely. Anything that is available on the Cover Virginia website, and I would dare say at the VDSS website, to Katie's point, that is publicly available. We want you to print out. We want you to disseminate. We want you to make sure that the members that need them have them in hand. And you can place them wherever you would like in your buildings, out in the community. You can give them directly to other subsequent stakeholders within your network. We encourage you to do all of those things in order to make sure everyone has the appropriate information. Another question that came across is for those who, will the renewal packets be provided in the preferred language of the customer, and or would they need to call to get interpretation services? And if that is the case, what is the process for doing that? Who would like to take that question?
Let me take a stab at it. We have translated most all of our forms that come through the DSS eligibility determination system into multiple languages. May not cover all languages at this time, but we have had them translated into the top, Katie, correct me if I'm wrong, 5 or 6 languages. So how your renewal form is printed is based on the language that you selected at the time that you applied for coverage, or a change that you may have made with your local Department of Social Services worker to change from one language to another. If you have difficulty understanding or reading because you did not receive your renewal packet in the correct language, Cover Virginia does have access to a language line. And if you call them, they will be able to get the language line on the phone and help with the renewal process.
Thank you so much, Cindy. The next question I definitely know is a Katie question. It's a VDS question, a VDSS question, and an LDSS question, Katie. They've expressed that, trying to get in contact with a local DDSS worker has been challenging in the past and continues to be challenging. What would be the most appropriate approach for trying to contact an LDSS worker, as well as what's the likelihood they'll be able to get clients in to help with that packet in person?
You gave me the best question. If that individual is having problems trying to get in touch with their worker, which I know, especially I think with the pandemic and people being in their office and not in their office, some have access to phones or not. If you call, they're not going to give information to someone that's not an authorized representative. So a mother calling, for their adult child isn't going to work unless there's something on file stating they're allowed to talk to them. But if you cannot get in touch with the worker, I would suggest stepping it up to the supervisor. You can also call Cover Virginia and they will assist with, trying to complete the renewal. And they also send memos down to us sometimes or not to us, but they send them to the local agencies if they've had contact with a customer. And certainly we've gotten calls at the state from people that weren't able to get in touch with their worker as well, and then we've had to facilitate that. So there's always a way to get in touch with someone, even though it's difficult.
You did have the best question. So, what if this, and this is more of a niche question. I'm not quite sure if this is a Bill question and somebody question. It is, are Virginia employers who offer employee health insurance required to grant special enrollment period to employees and families who are no longer eligible for Medicaid? How are we working with them to inform those employers about the unwinding in itself? And I'll take the second part before we get to the first part. The second part is we have tried our very best to send out the information regarding particularly phase 2 and 3 of the unwinding for those who have employees that work for them and they are still eligible, or they currently have Medicaid and they need to go through that renewal process. So we're doing all that we can across stakeholder groups to include a lot of you all to ensure that they have the information about what that process looks like so they can pass it on to those employees. As far as what happens internally for those employees who no longer qualified, I don't know if anybody on our team here can answer this question. If not, we will refer it to some in-house SMEs and then get back to you all. So I'll pause there to see if anybody can answer that question. Oh, the first time we are 4 in, and this is the first one that has stumped us all. It is 9 people.
There's discussions, if we're talking about HIP, there's internal discussions on how we're going to move forward with them, and those announcements be made over the next few months.
Oh, Bill comes in for the win. All right, so we're going to have an announcement for that one later on. We can't answer it this evening, but we'll make sure that at the very least in the FAQ document, we refer to that decision that will be coming down at some point. Thank you so much, Bill. All right, the next one would be if people wanted to, this one is probably for, go ahead.
Allie, I just want to make sure that I heard the question and that we got the person what the intent of the question was, because I interpreted it totally different than Bill, and this is not my specialty. But what I thought I heard was the individual asking, how are we working providers? You're letting them know, blah, 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 which you answered.
Mm-hmm.
That an employer would need to have an open enrollment if they are losing. So employers will know, per what you said, like, when we're reviewing, this is reviewing, blah, blah, blah. But employers required to offer open enrollment for that? And does it qualify as a condition to meet open enrollment and so forth, or not open enrollment, but outside of open enrollment rules? And then 2, are we monitoring that in some way to make sure that those employers are making sure individuals have those opportunities? That's the way I interpreted it, but I could have done that wrong. I didn't necessarily hear it as a HIP issue. So
I would not. That's definitely not my lane on the highway. So
if the person asking the question could just pop it in to make sure we clearly understand so that we can prepare it for the FAQs, that would be great. And yes, I see Bridget said it's considered a life change, which that was my presumption. It is a life change. It is a big thing. It's like having a baby or your kid turning 26. I just wanted to make sure we were answering the right question.
So I have a copy of the question that's in the document
Oh.
that goes to our overall thing of FAQs. So I have that in there. But if someone has more context for the question that's here, please by all means drop it in the Q&A or in the chat. We'll make sure that it happens. Thank you so much, Anne, for diving a little bit deeper into that question, because I would not have known to do that.
Right. And I could have completely misunderstood too, because, I don't have that much knowledge. When I heard it, I'm like, oh, I wonder about that too. So
Thank
as
you.
you can see, even our subject matter experts are like, okay. So that happens. That speaks to the complexity of the work that's done. The other question is, will redeterminations be based off of the 2023 FPL chart income determinations that came out in January?
Redeterminations of eligibility for income will be based on the income limits that are in effect at the time the redetermination is completed.
Okay.
So yes, if it's done this year, we will be using 2023 income limits to determine whether someone meets the income criteria.
But if it's done in January of 2024, then it will be.
Well, yeah, it would depend on whether we finished it really quickly in January before the new poverty limits came out. But yes,
Absolutely.
we'll use the limits that are in effect at the time of the redetermination.
Absolutely. All right. Another one will be, will the auto renewal clients get letters in a specific, we get this question randomly, but it's true. Will the auto renewal clients get letters on a specific color of paper? Medicaid used to do this, and they want to know if that is going to happen moving forward.
No.
Well, that was a very simple answer to that question. That's a no. So, and so we have a couple of more, but we'll make sure we roll those over into our FAQ document. We thank you so much for your engagement. We thank you so much for all of your questions. Before we leave for the evening, I'd like to give the opportunity for each one of our subject matter experts to, give us some parting words. And so I'll start with Bill. Do you have any parting words that you want to make sure everyone remembers?
Yes, I do. Tia wanted me to relay the message for the providers out there that are doing the billing. Please, please, please check eligibility before you bill DMAS and make sure that person's eligible before sending in your billing. Thank you.
Thank you, Bill. All right. Next we have Anne. Any parting words for us, Anne?
hey, did you hear that you really should check Medicaid eligibility before providing any bills? Yes, Tia and I keep saying that over and over as everybody else, but it also affects those individuals that might be on DD waivers. You as a provider may go to bill and find out they're no longer eligible. And if their Medicaid eligibility goes away, gets terminated, their authorizations do too. And we know what happens with those authorizations. They may or may not go back to the date, and you may not be able to recoup those funds. So it's really important to help the individuals, help their rep payees, and understand where they are and if they're going to lose eligibility as quickly as possible, because it could negatively impact you as well. So another little hit to check eligibility.
All right. Michael. Michael, do you have any parting words for us?
I think the one thing that I'd like to leave you with is just to let you know that the appeals division staff is always willing to help with procedural guidance. If you, as an advocate or representative, have a question about the appeals process, a member of our team is always standing by, ready to help. So I hope you all have a great night.
Thanks, Michael. What about you, Katie? Any parting words?
Well, I have my perennial parting words to tell people. Please, advise your individuals that you work with to check their mail, look for anything in particular that's coming from VDSS, their local agency, DMAS, so they don't miss their renewals, they don't miss checklists. But then I had another thought as I saw comments coming up. If you are a provider and someone is getting long-term services and support from you, please make sure you send a DMAS 225 to the local agency. because during the past couple of years where we've enrolled people and there hasn't been that 30-day period from where they've been approved and what we call presumptive enrollment, if we don't have a 225, we don't know who the provider is and if they're still current. And so make sure that you're getting 225s to agencies if individuals have started care or terminated care, respectively, but definitely to tell people to check their mail.
Awesome. And before I wrap things up, Cindy, our all-knowing eligibility enrollment specialist.
So I would just say, if you're working with an individual, please, please, please make sure we have a correct address on file. Because if we don't have a correct address on file, we cannot get in touch with a member. And if we can't get in touch with a member, it could be that the renewal or the redetermination of eligibility won't be able to be completed and the individual's coverage could be denied. And if we don't have the correct address on file, they may not even get the letter that says that they no longer have coverage. So please, please, please encourage the individuals you work with to ensure that we have the correct address on file for them.
Thank you so much. So, Elvira, we are a couple of minutes over, but we want to, before you go, make sure you know you are appreciated. We thank you for the work that you do. We thank you so much for the time that you are spending making sure that our community members have the guidance and the advice they need in order to successfully navigate this process. It may be complex, but we know that because of your kind heart and your wonderful spirit that you will make it an easy one, a wonderful one. As you can see, everyone here is very passionate about making sure that our members are getting the best quality customer service possible. Our director reminds us often that none of us will be here and we would not be able to do this job well if we did not have members and we have happy members that have great health insurance. That is our whole job. And so we want to make sure you have what you need so that you can help them. If you have any questions for us, you have the email address there at the bottom of the screen, covervirginia@dmas.virginia.gov. We encourage you, we empower you. We hope that you go out and do great things and that you circle back to us if you need us. We thank you for spending your evening with us today. And we thank you for all the work that you continue to do. You have a lovely one and we thank you again. All right, have a great one, everyone. Thank you so much, DMAS and VDSS and everybody else that came out. Bye.